Gross anatomy, in summary, is the respiratory system including the mouth, nose, larynx, trachea, bronchioles, and alveoli. The upper respiratory system begins with the nose and ends with the pharynx. The lower respiratory system begins with the larynx or the voice box and ends with the alveoli. Physiology is the organs of the respiratory system that make sure oxygen enters our bodies and carbon dioxide leaves our bodies. Included in the upper respiratory tract are the nostrils, nasal cavities, pharynx, epiglottis, and the larynx. The lower respiratory tract consists of the trachea, bronchi, bronchioles, and the lungs.
In this segment, I will be talking to you about the respiratory system and its parts and their functions. Here we have the oral cavity, it's kind of in the back of your throat, and the pharynx, which is the process of swallowing, and it serves as a pathway for the movement of food from the mouth to the esophagus. Here we have the nostril, obviously you know what that does. The larynx, which houses the vocal folds, which are essential to phonication. Here we have the trachea, it's kind of lower in the esophagus, which provides airflow to and from the lungs for respiration. And in the lungs we have the alveoli, which is the gas exchange of oxygen and carbon dioxide. And we have the lungs, which obviously bring oxygen to our blood and get rid of carbon dioxide. And in the lower lungs we have the diaphragm, which is a primary muscle used in the process of respiration or inhalation. The main function of the whole respiratory system, which is to take in oxygen and expel carbon dioxide and provides oxygen for the blood. Some more diseases besides the lung cancer is asthma, bronchitis, pneumonia, and cystic fibrosis.
Out here on my 10th cigarette, I'm going to tell you about my condition called lung cancer. Lung cancer is the number one cause of cancer deaths in both men and women in the U.S. and worldwide. Cigarette smoking is the principal risk factor for development of lung cancer. Passive exposure to tobacco smoke also can cause lung cancer. Treatment of lung cancer can involve a combination of surgeries, chemotherapy, targeted therapy, immunotherapy, and radiation therapy, as well as newer experimental methods. I got no treatment. I'm finna die. Resistance from smoking is the most important measure that can be taken to prevent the development of lung cancer. But I'm gonna keep doing my thing. Cancer of the lung, like all cancers, results from an abnormality in the body's basic unit of life, the cell. Normally, the body maintains a system of checks and balances on cell growth so that cells divide to produce new cells only when new cells are needed. Disruption of this system of checks and balances on cell growth results in an uncontrolled division and proliferation of cells that eventually form a mass known as a tumor.
Stop. Get some help. Fun facts.
Did you know that the right lung is slightly larger than the left? Bet you didn't. And that the hairs in the nose help to clean the air we breathe, as well as warming it. And the highest recorded sneeze speed is 165 kilometers per hour. That's impressive. And the surface area of the lungs is roughly the same size as a tennis court. And also, we lose half a liter of water a day through breathing. This is the water vapor we see when we breathe onto the glass.